My name's Sharon Hart. I'm a maternity support worker in the Bluebell Birth Centre. I love working in the SWFT maternity team because we all work really well as a team together to help support the women and their babies and make their experience of birth the best it can be.
My name's Nikki. I work in theatres. I am the obstetric theatre lead here at Warwick. I love working with the SWFT maternity team. We'll all probably say exactly the same thing. We're just like one big happy family here. We all protect each other, we all look after each other. We love our jobs, we all love the women that we've got here. It is just one big family.
Vicki Williams, I'm a nursery nurse. What I love about working in the SWFT maternity team is I think we're all really keen and enthusiastic about what we do and giving best possible care to our patients. Even when we've had really difficult days, we all get in as a team and help each other.
I'm Keeley Davey. I'm one of the practice midwives for the Topaz team in community. It's a great atmosphere here, despite the pandemic and despite all the barriers such as PPE. We have a great teamwork here, very supportive for each other, motivating each other and basically keeping each other laughing.
Hi, I'm Claire and I'm a maternity support worker. I think what makes maternity stand out is our team are really passionate about offering women and family-centred care across all of our maternity services.
My name's Claire Brummett-Brown and I'm a midwife here at SWFT. I think what makes SWFT maternity stand out is the quality of care amongst the teams that you will meet throughout the entire antenatal, labour and postnatal period.
My name's Hazel Peden and I'm the Maternity Inpatients Manager. The team have positively responded to the COVID-19 pandemic by doing an amazing job of pulling together and supporting each other through such a difficult and challenging time. They have adapted to every challenge and change that has been flung at them really well and quickly and without much fuss. They've done a hugely amazing job at supporting patients through what is obviously a very anxious time. We've put in some changes like adapting the midwifery structure of care so that we can provide care safely. We use our PPE and we support them in having a birth partner throughout labour.
My name's Michelle Waterfall, I'm the Deputy Head of Midwifery. I think the team have positively responded to the COVID pandemic through being completely flexible. Their response has meant that we've been able to maintain many services for our families and not have to pull back. So one of the big things in the very beginning of the pandemic, we had a huge increase in the amount of home births we were supporting. So the team were really flexible in their response to that, changing their shift patterns so we could facilitate those services for women.
Amal Ilasi. I am a specialty doctor in pediatric and neonatal unit. The team respond positively to COVID pandemic very well. This is my first job in UK, but I find the place is very organized and the team is work as a teamwork. They put very fast guidelines for COVID. And they are putting a PPE also guidelines and very easy accessibility to PPE and very noted signs everywhere. They work well together as a team. If anyone had symptom or anything, they will cover.
My name is Karen Lynch. I'm the antenatal and newborn screening coordinator here at Warwick. The team here at Warwick have positively responded by a number of ways. First of all, support for the staff. So we've had regular updates via our Facebook private group for all staff members, so we're kept up to date at least 3 times a week with any developments within the trust. We also receive regular emails from the whole of the trust in terms of what we are doing regarding vaccinations and the COVID numbers within the trust, so that we're all kept fully up to date. And also the support that we've had for our mental health has been absolutely outstanding. We can drop different coloured hearts to let the senior team know how we're feeling, if that's a way that we wish to convey that. And also we've got our professional midwifery advocate who has invited us all individually, if we wanted to talk about our feelings and what our concerns are or how we are feeling generally.
My name is Margaret Mayhew and I'm a neonatal nurse working in the special baby care unit at Warwick Hospital. So I think all responses for something like this really comes from the top, And I think we are very lucky here at Warwick because we have a good, robust leadership that comes all the way down to our managerial level. And we were given very clear instructions on what to do, and I think that was communicated throughout the maternity department very well. So we were all very clear about what we should do, what steps we should take, and how that would affect our working life. And I think on a personal level we felt that was quite reassuring, and we felt that we all knew what we were doing, and if things happened then we knew that we could ask those questions and get good answers. We felt we were supported, and I think everyone showed great professionalism, and I think, to be honest, it made our teams much more caring. We were much more we thought about each other more in what we were doing because we were all going through a similar experience, and some people perhaps more than others, they might have had personal experiences they were working through, so we all really helped each other.
Hi, I'm Lisa Leeks. I'm the ward manager for the Birth Centre and Community Midwifery. I think the teams positively responded to COVID by continuing to promote home birth and welcome new families into the birth centre. We've also worked really hard to ensure that women can have their birth support throughout every stage of their pregnancy and birth journey.
Esther Boyle, SCBU manager. What makes Swift Maternity stand out? I've worked at it for a long time, and it's gone from strength to strength. There's strong leadership, and the staff are caring and compassionate and responsive to the needs of the local people.
I'm Sugani Sukumar, and I'm one of the consultants at Warwick Hospital. We as a group responded positively to COVID-19 pandemic by pulling ourselves together. So basically we communicated very well within our team. This includes the community midwives, and we created a Facebook group specific for women who are using our services as well. So based on that, our community midwives were able to raise any questions that they had about dealing with the pandemic to the acute team, and we were able to respond to them in a timely manner so that our care to our community was seamless and safe, so that our women did not suffer through the pandemic. And also for doctors, what we provided is in terms of how we safely use our personal protective equipment. We created videos, we disseminated through our WhatsApp group, which was specifically created during the COVID pandemic. So this helped us in understanding how we can run the services safely and how we can provide that services safely to women when they come into hospital. By communicating well, by keeping us all well informed and updated with the latest guidelines from the Public Health England, and also keeping that communicated through various channels, we ran the service safely and we worked positively. Thank you.